We're going to be talking about mjadala. Leo tunataka kujua watoi wako safe kurudi shule na venye corona zina spike. Is there anything that parents should know? And we decided to get our very good friend Dr.Mercy Korir to speak to us about this because there are concerns. You can imagine on one end the country is saying, there's a spike in cases. Yeah. Yesterday there were 7 deaths, which means there's an actual spike.
Yeah.
And you've heard even from MVPs saying that, okay, people are not putting on masks. I told you my scenario yesterday. And speaking to Dr. Mercy Korir, she told me outside of Nairobi, there's no masks. So what should parents know? Doc, karibu sana kwenye show.
Asante sana.
How you doing?
I'm okay, I'm good.
Good morning, Doc.
It's Kevin in studio.
Oh, Kevin, hi.
Hello, Doctor. Doctari.
Doctari, welcome to the show.
Thank you very much. Glad to be here this morning.
Yes.
So you can
Yes.
hear. In fact, Doc,
Yes, I can.
Doc, do you know what's trending right now at number 5?
What is?
COVID-19 KE. Yeah.
That our cases are on the rise.
Yes.
Again.
Okay. All right. So, if you when you test, you're bound to make a diagnosis, right?
Yeah.
When you look, when you're, what do you say? When you're not testing, then you will not find. The same argument that the Americans were having, that, we have so many cases because we are testing.
Yeah.
But that's it. If you have a lot of community transmission like we've seen in the country, obviously there'll be many numbers. So for me, it is not about have we made a diagnosis, do we know who has the disease or not, but rather how sick are our people. As you've seen, COVID has been very polite to us that we've got more than 90%, 93% of people who have been diagnosed, but they do not have any symptoms. So that means it is a mild disease.
Yes.
Where it becomes a problem is when the disease is severe and heavy on people.
Okay.
This is when it is a problem.
Yeah.
So for me, when we find the cases, it's okay, but what's the state of the people that we find with those cases?
Okay.
Yeah. So if people are asymptomatic or do not have any symptoms, it means they will be okay.
They will be okay.
So my worry, they'll be okay. My worry, as I've been all along, is now your most vulnerable people, your elderly people, because those are now the people who, when they get a disease, it's going to be very severe. Those are the people that need to be protected. Those are the people that we need to know that that we have access.
Yeah.
That they can get access to healthcare services when they need it.
And Doc, which is the reason we're having this conversation today. Are kids safe to go back to school? Of course, you've just brought it up. When we were speaking yesterday, you said kids are safe. What do you mean by that?
So we have seen that this is a disease that affects people with pre-existing conditions and people who are likely to be elderly.
Yeah.
When you look at our children, especially grade 4, class 8, form 4, those are a majority, more than 90%, will not have any of the diseases that would make COVID-19 very severe to them. So they are okay going to school because even if they get the disease, they are likely to weather it out.
Yeah.
Okay.
And two, those are very few numbers of children going to school as opposed to everyone going to school. So they are likely to have physical distance. They are likely to be washing their hands, because now the amenities in the school that was for 800 people, for example, are now being shared by 200 people. So it's easy to maintain physical distance and keep a track of them and make sure that if any one of them falls ill, then they are able to be taken care of. I would actually be worried about the teachers and the support staff in the schools who would be taking care of these kids when they're in school, because now those are the ones who are vulnerable. The child may have and transmit to them, they are the ones who are likely to fall sick.
So, Dr. The fact we heard in the news the other day, teachers were complaining and they say they don't have enough PPEs.
Well, they don't need PPE.
Well, they probably do need PPEs.
Kwambox has actually said it.
Teachers don't.
Okay, but moving forward, do you think parents actually have a right to feel worried that teachers, especially the fact we saw teachers, some teachers don't even wear masks? you know?
So here, what we need most. You know, when you talk about PPEs, people think about those pistols and the like.
Yeah.
So no, what people need is their mask and hand washing.
Yeah.
Yeah.
That actually
But some
has
places
been
don't even
shown
have
to work.
water.
Yeah, and that brings us to the
So
next question.
That is now what that should be addressed. Do schools have enough water? Because soap is most readily available, but do they have enough water
Yeah.
for all of these kids?
Yeah.
And this is
Yeah.
the big question. And I was watching a roundup yesterday of different counties because kids are going back to school since Monday. And looking at the paper today, they're saying that 90% of, say, Form 4 students are in some counties are back to school. And then you're looking at, initially when we started this whole COVID campaign, the idea was we can't use bar soap because you use it,
Yeah.
you put, the next person will
Use it as well.
use it,
Yeah.
so it brings a challenge. But some of the schools resources are so limited, they're actually giving the kids bar soaps.
Yeah.
Yeah, is this something that kids should worry, parents should worry about?
For me, I wouldn't worry about it because it's okay. You just think about it.
Yeah.
Once you have lathered your hand with soap and you wash with water and your hand is clean, you won't go back to the bar soap.
Yeah.
Yeah.
You will have cleaned whatever it is. And bar soaps are actually very good compared to all of these other fancy soaps. So I wouldn't be too worried about those nitty-gritties.
Yeah.
The big thing there is, do you have soap?
Yeah.
Do you have access to water? Which is now what should be the big conversation. Not even about providing masks, because especially the younger kids, they need the masks.
Yeah. Another question.
Yeah.
Which is a big concern for some parents. You have a child who has a pre-existing condition. They're candidates. They're in grade 4. They're in Form 4. Should the parent send them to school? Say they have sickle cell anemia.
So no, those are not the kids that I would be worried about, because now here you are with a child who is vulnerable. What do you do? I would think the parents with such kind of kids should have a conversation with their doctor so that because they will now know the current health status of the child, whether they are at a vulnerable state or not, so that an individual decision can be made for that individual child.
Yeah.
Okay.
So I would think that parents with children with existing conditions like sickle cell, some children have cancer, some have diabetes.
Yeah.
You know, they should have a conversation with their primary physician or their primary pediatrician, so that they can make a decision for the child that works for that individual child, and then in consultation with the school. Because that would be a challenging one, because here you're caught in between the health and the life of your child, and then going back to school, which is still an important part of their life.
All right, Doc, we got to take a short commercial break. Then we'll come back. And, of course, I want to take you to a whole other level where, well, they're talking about if this 2 weeks work where candidates, the grade 4 are in school and it works, they might now open up for all students to go back. Now, keep in mind, there are no extra classes that have been built. They're talking about social distancing, and it doesn't really look as distant as possible.
Yeah.
Is this the right thing to happen while they're spiking? The cases of COVID are going up. We'll talk about that. Hold that thought.
Okay.
Listen, we are speaking with Dr. Mercy Korir on Mjadala today. Of course, kids are back to school, schools are back open, but something else is happening. COVID is on the rise.
Yeah.
And of course, there are a lot of concerns. You have grade 4 students, you have Form 4 students, you have Class 8 students, you have parents who are like, wait, if I can't go out, and engage, how will my child go out there and engage? And then they're talking about in 2 weeks' time, if things work out, the rest of the kids will be back to school. So Dr. Mercy Korir, welcome back.
Thank you very much.
So in 2 weeks' time, if this is successful, the rest of the kids, I'm talking about Class 1, nursery, everybody's back to school.
Yeah, I think that should be the plan, because this was about quote unquote testing the waters to see, and we've seen it's not unique to Kenya. We've seen that all the countries have tried to, open schools piecemeal so that they are able to see how the kids in school behave. Because you see, much as COVID is here with us, we are also trying to live our lives and go back to our lives the way we knew it. We may not be able to get there, but we're trying to do that. So the whole plan is to open with a small cohort, find out how they respond, how they react in school, with their spike in infections, so that if there is a spike in the infections, then you close up. As in, there's no harm in saying that we've seen this and we see that it is causing more harm than good, and so we are closing. So it's about just trying and see. And I think if it works out, then it makes sense now to open up and say now we can gradually phase out the opening of the school for all the other kids, and see, so now which classes do we get next? Is it our from 3, from 2, class 7, and then they have a phased opening or a phased approach towards that. So this is just a matter of, and I can understand why they went for the candidates first, because you want to have an with learning. From one class to the other, from one student to the other. So I can understand why you have the candidates going first, and then now, the rest of the classes. So I think if it doesn't work out, no harm. You close and kids go back to school. If it works out, you now you escalate or you scale up. Scale up is the right word. You scale up to the
so now
students.
Well, speaking of candidates, I believe there's also some psychological problems regarding their stay in school, especially as they prepare for exams. So some of these problems obviously include the fears and worry about contracting the disease. I'm sure some of them have even had relatives who've gotten the disease, and unfortunately some of them even died, the relatives. So how do you think teachers and even the government can handle this emotional toll on some of these students?
I think you put such an important point that we've seen throughout this pandemic. That the state of mental health that has been neglected over time, and we saw that people took a deliberate effort to look into people's mental health and mental well-being during the pandemic. So I think it's one of those important things that should be part of the conversation, part of the going back to school arrangement, that there is counseling, there is psychologists or people that will talk to these students about going back to school. And not just the students, even the teachers, they are worried. The support staff, everyone is worried. And there is sort of a conversation about what to expect when they go back to school, what to do should anyone fall. Because remember now that students are congregated together, somebody may get a flu. Somebody may get a flu, and then, they will be told corona, but it's not even corona. It's nothing else. Somebody may get malaria, then they're running a fever, then people think, now you have COVID. So I think the conversation around mental well-being should be part of the return to school plan, and this should involve everyone in that school community and even the community around the school, so that if they see that student has fallen ill, has malaria, is going home, they don't panic, or they hear somebody has COVID from the school, they don't panic. Because as we have seen, we can manage. Yes, we have lost a few people, or we've lost many people, hundreds of people to COVID-19, but we have seen out of the people who have recovered, out of the people that have gone home, that this is something that we can deal with. So I think giving people that message of hope that this is something that is manageable, this is something that people can weather it out, I think will make all the difference in terms of how people view people who fall sick in school, because it's inevitable. And even how people deal with each other in school and COVID-19. So I think it's an important part of the conversation.
Doc, when I'm listening to what you're saying, so in a nutshell, we have nothing to worry about.
From my perspective,
Okay.
my perspective, we've had this COVID for, now we're going to the 7th month.
Yeah.
Actually, the 7th month last on top. So we've had it for the last 7 months. We are still it and it's worse. Remember, there was a time we did not even have ICU capacity for people.
Yeah.
We had almost everyone in isolation. But now people are isolating at home.
Yeah.
And they are getting okay. They are going back to their lives. People are going back to work. Even in our handling of the virus in the lab, we are no longer now putting it high there with all the other infectious diseases. It's your other regular, virus. Okay. So I think for me, we have learned now compared to where we were in March to know that this virus we can handle. In March, everyone was panicking. We were seeing the pictures from Europe. We were seeing what was happening in America, and we were like, "Bus,
we are gone."
Yeah, we are gone.
Yes, but now we have our own data. We've seen that 90% of our people will not even have any symptoms. So for me, that is a good thing because it shows we have our own information locally to make the decisions about the virus. And for me, what I'm seeing from the data is we can handle it. Right. It's just now that can we handle when there is a critical illness or a large group of people who are fallen suddenly ill. That should be the question. But as it is now, we can handle. We know enough about the virus to know that we can do some of these things that we are doing, like opening up schools.
All right.
And even bars and restaurants.
Yeah. One final question. This one is by Melanie, who is a student. And I think she's supposed to be going back to school. I think she's in Form 3. And she's like, and then where are we going to sleep? Wanataka to suffocate. They want us to wear masks day and night. Do these guys know how crowded schools are? In our school, we have 1,500. How are we going to be managed plus all the teenage craze? Mimi Kwambox, no. What do you say to her, Doc?
No. And then Melanie, you do not have to wear your mask throughout.
Yeah.
Like, you the same way you have been behaving at home is the same way you'll behave in school. When you are with other people, obviously you wear your mask.
Yeah.
When you're going to sleep, when you're going to the shower, to eat, you just remove your mask temporarily for that particular period of time.
Yeah.
So Melanie should not really worry. The same way you've been doing at home is the same way you go and do at school. It does not change just because now the thing has changed from home to school.
So basically you're saying, Doc, if I'm familiar with you, there are some people I should have my masks off with, like my bunkie.
No. No. Okay, if you're sharing a cubicle with 4 people, practically it's going to be difficult to have your mask on.
Yeah.
But if you've gone to the assembly, to class, that's where now you're meeting another whole group of people. You wear your mask and you make sure you've washed your hands at all times. When you're meeting your cube mates, you make sure your hands are clean so that all of you make sure your hands are clean so that the surfaces you're touching, because you want to touch the same surfaces, are not contaminated.
Yes.
That is why he is saying what is most important and most critical is hand washing, because it's your hands that carry germs.
Yeah.
So if your hands are not clean, because remember when you're removing your mask, you'll have touched your mask. So have you washed your hands immediately after that so that any surface that you touch is not contaminated? So hand washing for me here comes first.
Okay.
And to add on that one, just because I know there's many students out there who have, not many, but quite a number who have diseases like asthma, for example. So would you advise them to have their masks on the whole time?
Yes. They can wear their masks on.
Yeah.
Because remember, asthma is because of an allergic reaction. That maybe it's cold, maybe it's dust. It's actually, in my opinion, I think it will actually be very good for asthmatics because now you'll have limited the dust that you're inhaling. So asthma is because of an allergic reaction as opposed to an infection. So yes, they can wear their mask on, but they should still continue with their treatment as usual, because normally they are on long-term treatment. Some have inhalers.
Yeah.
So they should make sure that their asthma is still well under control all the time. And that's why I'm saying anyone with a pre-existing condition should have a conversation with their primary physician or their doctor first before going to school so that they can have a plan that suits them. There are people with asthma and it's all controlled. They've not even had medicine or an issue for years. But then there's that person who every week has an attack.
Yeah.
So those are the conversations they need to have with their doctor so that there's a proper plan for them individually when they go to school, and then they'll be told of what to watch out for as an individual, so that they know when to ask for help or when not to. And also, I think now they should inform their colleagues that I'm asthmatic. If you see me coughing, don't panic.
Don't worry.
You know?
Exactly.
Yeah.
So we need, thank you so much, Dr. Mercy Korir. This has been an informative conversation. I know the parents are really appreciative of this. Doc, can we take a few phone calls? Because I can see the phone is ringing.
Yes.
All right.
You can. You
All
can.
right.
Definitely.
Let's speak to Charles. Charles, good morning.
Morning to Kwambox.
How are you doing?
I'm just fine.
Uko na swali unataka kumuliza daktari? Airtime yake ndio hiyo imeland. All right, we're going to open the phone lines. The number is 0719012700. If you got any questions you'd like to ask Doc, remember you can also use the hashtag Kwambox and Kev. Doc, I'm going to have to let you go. Thank you so much for coming through. And in case of anything, we appreciate you.
Thank you, Kwambox. Anytime when you have any issues, call me up.
All right. That's Dr. Mercy Korir.
Right.
She's a doctor. She's a doctor and a journalist. So she's a medical journalist. Medical journalist. Medication.
Playing reggae like you've never heard before. This is Vibes Radio.